Hey, what's up everyone? It's Dr. Glenn Vo. I'm here in the windy city of Chicago. I'm here at Lakeview Endodontics, office of Dr. Mindy Van. Let's go check it out.
So before we get into this episode, I'd like to give a shout out to one of our sponsors, CareStack. CareStack is a cloud-based practice management software, and it's an all-in-one solution where you can save a lot of money. Check out their website and make sure you ask for the Nifty Thrifty deal.
Mindy, thank you so much for inviting us here.
Welcome to Lakeview Endodontics.
Okay, so the first thing I gotta tell you is right when I walk in, this is the nicest endo office I've ever been in. So I have to ask you, why was just having this kind of design so important to you? Because you think endo, you're getting patients referred to you and you're just gonna do the work and you refer them away. Who cares how it looks, but you put a lot of thought into it. So why is that so important to make an office look really nice like this?
First of all, we worked with a wonderful designer, Ron Ellers from Metrotech Design and Andrews Construction. And, my family, they owned salons that are spa-like, and we wanted that same atmosphere here. We want patients to come and feel relaxed with, relaxing color. Getting a root canal can be very nerve-wracking, and patients get really nervous. But when they get here, they can relax on these lounge chairs and sit and listen to spa-like music. So that helps relax them.
Again, this is a beautiful office. Let's see the rest of the office.
Sounds great. Let's go. The hardest part of designing this office was to create a flow of patient entering and exiting, because you want to avoid the whole bottleneck. You don't want patients to check in and check out at the same spot. And that's the part that took the longest. We had to go through like 4 or 5 revisions. So here we have patients entering through this door. Okay, when they check in, they will enter through that door, and then when they leave, they exit on the other side, and they'll exit out in this, vestibule area right here. So that was the hardest part for me.
Okay, so how many total operatories do you guys have here?
We have 10.
10
operatories. Actually planned for 12, but we're only going to outfit 10. Okay. And right now we just bought 2 more chairs, so we're going to get the 9th room, the 8th and 9th room done.
Well, so how many? Because right now in this practice there is. So there's you and you said 3 other doctors?
Two other, so me, yes, 3 total. I wanted to point out, if you look down the hall, you notice how like in certain sections we have a different wall covering, and that is to break up the long hall look.
Wait,
you see how this right here has a different texture wall covering, and then right there too. So that when you're looking down the hall, you have like a different design that wraps up towards the ceiling here to kind of break up that long hall.
So it's from up here all the way up to the ceiling. Wow. It's details like that only an endodontist would really appreciate, because I didn't even notice that. Wow, that's amazing. Yeah. Okay, so this is a nice room. I love these barn doors with the glass, but this almost looks like lecture room or something. Was that the intent of this particular room?
This room, it's called conference room. It's the room that we have meetings. It's the room that we do our CPR training because we needed a bigger space.
Yeah.
We also had, tables for entertaining if you have an open house or a party for our referrals. So this is a great space. You can even bring your yoga mats and do yoga in here. Yeah.
And was the plan all along was to use this as kind of like a conference room, or was this going to be one of those ops?
The plan was supposed to be 2 more operatories.
Oh, I
yes,
see.
it was supposed to be 2 more operatories. It's plumbed. We have all the electrical and everything. It's all plumbed for 2 future operatories. So in the event that we...
if you just expand so much, you might have to?
We might have to. And the best part is that if you put a drywall right smack in the middle, this can just serve as a door to that to each op.
I love that.
Yeah.
Instead of having just a unplumbed op and not using it, you guys are actually using it for something. You're using it for conferences, for open houses, and of course, if you have to, you just stick in drywall. I love that.
Yeah, the drywall, and then you're good to go. You're ready for 2 more operatories.
Man, even the sterilization. I love these cabinets here. Are these custom cabinets?
These are all custom cabinets, and if you guys notice, I love wall covering. I love wall covering.
Yeah.
You can wipe it off if it gets dirty. I love that. This office, we decided to go with the quartz. Our last office was just laminate, but then what I noticed over time, it started discoloring.
Yeah, was it like breaking apart or
it was
something?
like orangey. Yeah.
But again, this looks very stylish, but it also seems like very easy to clean as well.
Yes, it is. Yeah, quartz is
Wow.
very durable.
Okay,
Yeah.
I love that. I love that. And then back here again, everything looks again the minimalist, right? Like
Yes.
there's nothing else there. You got the tip out bins, and it doesn't seem big, but there's everything. All the space has been used like very efficiently.
Yes,
That's
yes,
one thing
for
I
sure.
noticed there. All right, so we're in the break room here, and what I love so much about this break room, it is very spacious. And you got this right here. I don't think I've ever seen, I'm going to lift this here, guys, and you can explain why you have this here. There's a stovetop here. So was the philosophy just to have a lot of space so that your team is happy and you guys can sit and talk and eat together and relax? Tell us the philosophy behind it.
Well, we wanted to have a full kitchen so we can cook and eat, heat up food. Right. So we have this cover right here that goes on top of the stovetop, so that way it will allow more countertop space. So if we were to spread all the different food items when we're cooking a whole bunch of foods, then we can share it with each other.
That's very efficient and very smart planning. And of course, let me open this. You got an oven here too. All right, so we're in your private office, and you have one thing that I absolutely love, because when we were designing my practice, my wife absolutely had to have it, and that is a private bathroom. And let me ask you this, okay? Again, when my wife brought it up, she was like, we need to get a private bathroom. I was like, why? That's just more space. And now it's like, I just love it. So why was that important? Why is that important?
I really like to have my own space, like my own bathroom. I don't want to share with anyone. So I'm so happy we did that. We also added a shower in there so I can shower after work.
Especially when you're doing root canals all day, right? You just want to get that stuff all there, and you have a long commute, so you want to feel fresh and clean when you get home. But again, for those who are thinking that I want to save some space because I don't want to have an extra bathroom there, it is worth it.
Worth it.
Coming from her. Now, I see 4 good-looking guys back here. Tell us, who are these 4 looking good?
These are my 4 boys. We have Oliver, Harrison, Charlie, Harrison, and Henry. So he's my oldest. This is my youngest, number 3, third one, and my second one.
That's a lot of testosterone in your house. Now, any of these boys, might want to get into the family business of dentistry or doing endo? And have they talked about that?
No, not yet. Hopefully. Yeah, not yet.
Another thing I want to point out in the private office, and there's 2 private offices here, but I noticed that it's like a minimalist style. There's not a lot of there's not a lot of things there. Again, is that by design as well?
Yes, I actually like very few things out on my desk. I like simple and neatness, and even the color, very neutral.
Yeah, and very stylish as well. All right, so we're in one of the operatories, and again, we have the other half of the dream team here at Lakeview Endodontics. And Dr. Chen, hello, and
hello.
Also talk about when did you become a partner with this practice, and what made you, other than the fact that Dr. Van's super awesome, what made you want to partner up and join this practice?
Yeah, so I partnered last year, and I met her through my dad. She would moonlight at my dad's practice, do a lot of the endo there when I was probably in dental school at that time. And so that's how I met her, and I think a lot of our ethics kind of aligned, and she reached out to me when I became a resident, and she needed the help. And so she said, one of the biggest things that she said to me that caught my mind were, you do good work, everything else will come after that. And so I liked that, and I came here, and that became true, the way that she practiced, a lot of our philosophy aligned, and everything went well.
Now, when you became a partner, did you become a partner when she was at the old location or when she came into this nice modern location?
So it was right before we came into this location, so
Okay.
I did end up having to foot a little bit of the bill, which was tough. So it was last year we moved in March, and so it was a little bit of both, but primarily.
Now working in the old location and working here, much of a difference there?
Now certainly yes. For a while it was me and her really, we needed the help. We maxed out that space. We had 4 chairs there, 1 consult chair, and we couldn't do any more. And so we had people that wanted to help. Now we've got several more chairs, obviously, and we're still busy. The office at its maximum is bustling, and so big difference between the old space, obviously.
So for someone who is thinking about opening up a new startup or expanding, I mean, here at your office, you thought of everything. You thought about the bathrooms, you thought about the space, you thought about just making sure everything is nice and simple and relaxing. But what are some of the things that you would do different, or what are some advice you would give someone when they're planning out a space?
Well, add more electrical outlets for sure. I feel like we have to go back and keep adding, and every time you add afterward, they do charge you more. When they send you the drawing of your cabinet, the color, the laminate color, please double check, because once they complete the fabrication, you're not going to be able to go back. So you have to make sure that you look at the laminate, look it up online if you have no idea what color it is. That would be helpful. And you just have to be on top. When they're constructing your space, you should come out every 2 to 3 days. You should, because they'll put something that shouldn't be there, or they'll omit something. Like over there, we're supposed to have another piece of glass, and they totally didn't do the drywall for that. But it's okay. I think you can fix things along the way, but you have to catch it early.
Yeah.
Okay.
And for the other specialists who are watching this right now, and they're probably thinking, well, I'm going to get referrals. I don't care. I'm just going to have a normal office and not put too much into it. Talk about the reception, the type of a reaction you get when patients are referred over here. They see how nice it is and how comfortable. I mean, that has to help when it comes to referrals for other patients.
Yes, absolutely. They all complimented how nice it is here, how comfortable it is. And for me, designing the office and putting a lot of time and thoughts into the color and and the overall feel, we are here so many hours a day. We are here sometimes a lot more than our own home. So make it nice, make it comfortable.
Yeah, I mean, you know, you have to be here. You must as well be happy
Exactly.
to be here, right?
Happy to be here. Patients are happy to be here.
Now we don't have to mention any names, but do you ever have patients that are referred over and they're like, Dr. Van, your office is nicer than my other doctor's office?
Yes, we have heard that, and we have also had patients that ask, can you see me for other procedures? And I said, no, we only do root canals here.
Well, Mindy, thank you so much for having me here. We had a blast and so many things that we can learn from. But for those who watch this and they want to reach out, is it okay for them to send you a message on social media or something like that?
Absolutely, anytime.
Awesome. Thank you so much, guys. We'll see you next time.